Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Robert back here with us today for his second adjustment here at Advanced Chiropractic Relief. Now, Robert flew all the way down here from Seattle, Washington to get adjusted. And tell him the reason you came here to Houston to get adjusted rather than the, how many chiropractors did you say you've been to?
7 or 8 since an accident in 2016.
Yeah, you had a really bad accident in 2013.
And then I had one follow-up one.
Yeah, so he's had a lot of spinal trauma. I've looked at his x-rays, and he has degenerative disc disease in his cervical spine, thoracic spine, and lumbar spine. And his major complaint yesterday was it hurts all over. And that's a very common complaint for someone who has degenerative disc disease because it makes the disc thinner. That's what wear and tear is. Degenerative disc disease is a wear and tear process of the disc over time, and the vertebrae start developing calcium spurs to try to fuse the vertebrae together, which he has a couple of vertebrae in his spine that are almost completely fused with spurs. However, they are not completely fused with spurs. And you told me that a lot of chiropractors were afraid to adjust you, right?
Well, one of them told me you would end up giving me a stroke, and another one suggested my neck could get broken.
Well, I adjusted you yesterday. You didn't stroke out on us yet, did you?
Not yet.
Okay, so let's go ahead and show them how we did that. Okay, let's have you close your eyes and flex your head forward and backwards, and then neutral. You know, a lot of people wonder why other chiropractors don't do what I do here at Advanced Chiropractic Relief. And you know, I've tried to teach other chiropractors some of my techniques, and so that they could adjust me. And most of them say, you know, Greg, I really don't want to work that hard. What you do is way over and above what I do. I mean, if you get a pop here or there in the spine, patients think they got an adjustment. I'm here to tell you that that is not the case. You know, what I do here is a lot of work. However, what I do here is very effective for increasing the range of motion in the spine, taking the diagnosed vertebral subluxation complex and correcting that as much as possible while the patient's here. Unfortunately, Robert's heading back to Seattle this afternoon, but we've had 2 sessions with him, and at the end I'll let him tell you how he feels versus how he came in here.
Well, I'm a no pain, no gain kind of guy, and I got to tell you, the last ones didn't cause me any issues or pain. And I was in pain last night, but I'm feeling a lot better. You were sore more than anything. Well, I was sore, yeah. But I'm feeling better today, and you're the first one that's worked on my rib cage since I think 87. I actually had somebody that did that, but he's long gone by now, so.
Older chiropractor.
Older chiropractor.
Hands-on adjuster.
Hands-on.
Yep. Okay, well, let's start off with this one this morning, Robert. Butt right here, head up this way. Okay, let's lay you on your back, please, sir. And slide down this way a little bit. Slide down a little bit more underneath here. There. You know, a lot of chiropractors do physiological therapeutics such as ECM and roller tables and diathermy and ultrasound.
Yeah, you're describing one to a T. He's got the tables that
roller tables.
That and the one that goes up and down while you're laying on your stomach and bends you at the pelvic. And
flexion distraction, which that's a fairly good technique. But for degenerative disc disease at the level that you have it, which is moderate severe, your spine's been getting compressed for years and years and years. So what it needs to get is decompressed to take that pressure off the disc and the corresponding nerves that exit those levels. Breathe. There you go. his head's still on there. Now look at that improved reflex immediately. Yes, sir. Now he especially has severe degenerative disc with some huge spurs that I could hang a coat on at C3, C4. Drop it with your left toe. There you go.
I'll tell you, I feel like if I'd have seen you after that accident in 13,
yeah,
I'd be alone.
Probably wouldn't be as degenerate as you are now. Let's come over this way. Yeah, push it. There we go. All right. We're having some really warm weather here in Houston. It's supposed to get up to 78 here today. It was 72 on the way in for us.
Yeah, it's snowing in Seattle.
Snowing in Seattle. Look at there, legs are exactly even today. Yesterday, the leg was shorter. Now it gets a little shorter when I bring it up, and that tightens up a little bit in your knee and your low back and thighs, huh?
Yep.
Okay. And yes, I am using the same technique to adjust this severely degenerated spine that I do on every single patient because it works. I am using different angles, different strengths of my adjustment, the high velocity, low amplitude adjustment. I see he's so bound up in his mid-thoracic spine with degenerative disc disease and spurs that there's very little movement in that area. Perfect. Does that feel a little easier than the first one did?
Yeah.
Good. But you still need to put the vertebrae through a normal range of motion, which is what I'm doing with each of these adjustments. There we go, to the maximum integrity of the ligament through the paraphysiological space. That's where you hear the popping noise. And the popping noise is not your bones cracking. That's a nitrous gas bubble that explodes inside the joint space, the synovial joints. Now, Robert had a hard time getting his head back here this far yesterday, but now today, it's already much better movement. And see where his ear now is back here over his shoulder where it's supposed to be. Let's slide down this way just a little bit, Robert. And put both arms out like this, palms up. There we go, good, okay. Relax your hands right there. Yep. And you see he's so stiff all in his SI joints and his hip joints that this is as far as I can get his legs out laterally. The muscles shorten and they get really tight. Relax. Nope. There we go. Good. Okay. Now let's sit hip sideways and face that away, please. There we go. Come back this way a little bit. Now, if I do suspect you have atherosclerosis, which is a precursor to having a stroke or a heart attack, we won't even accept you as a patient here at Advanced Chiropractic Relief. So I make sure and look at ultrasound studies of the carotid and vertebral arteries. And if they don't have those, I'll send them out to a radiology facility here in Houston that we work with. No, sit back down for a sec. There we go. And his elbows are even locking up. For those of you who want to become patients here at Advanced Chiropractic Relief, you need to bring your diagnostic tests with you, x-rays, MRIs, CT scans, ultrasound studies, medical records if you've had surgeries. There we go, good, okay. Let's stand you up right here in front of the mirror. Now see you standing up straighter already.
Oh, I can feel it.
Yep, let's have you flex your head forward and backwards for me. Now that's a lot better range of motion. Back to neutral. Your head's still a little forward and right, so we're going to pull those there, flare these guys way back here. And then we're going to bring your head straight back. I'm going to translate you left a little bit, and now look at the wall behind you. Boy, you couldn't even do that yesterday. There. Okay. Yeah, I got you. I haven't lost the patient on the floor yet. I won't start with you. Okay. Now, try that same movement again, Robert.
Okay.
And see if this feels any smoother to you than the previous one.
Yeah, it's not grinding.
Yeah, take a look in the mirror right now. Look how we got equal spacing now between your hips and your hands. Your hands are more at your side now. Your shoulders are squared off. We're starting to get your head up and over your spine where it's supposed to be. So would you mind sharing with our YouTube fans around the world about how your treatment, your history, examination, and your treatment differed here at Advanced Chiropractic Relief from the other chiropractors that you've seen over the past few years?
It's like I told the last chiropractor that was so scared to do anything. I said, like, Keith Urban is a great musician.
Mm-hmm.
I play guitar. There are a lot of guitar players. There aren't too many Keith Urbans. You're more like a Keith Urban.
I'm not that familiar with Keith Urban.
Well, he's a fantastic musician.
Oh, is he?
Yeah.
Okay.
Country music singer.
Huh?
Country music
Oh,
singer.
that's why I don't do country music. I'm a rock and roll.
Well, he's just a great musician.
Okay, well that's great. So has this been a worthwhile experience for
Oh,
you to fly
absolutely.
down here and get this treatment?
Yeah, I can't get it up there, so.
You can't get it anywhere, right?
No. Not that I've found anyone.
Well, thank you for sharing your story with everyone.
I'll see you at 1 o'clock. You have another shot.
Oh, that's right. We got another this afternoon, huh?
Yeah.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief. We're in Houston, Texas, where we take care of some of the most severe spine conditions in the world. We'll see y'all soon.